Now, the first trait, if you will, the first psychological ability not developing on schedule is not attention, it is inhibition. ADHD is at its core an inhibitory failure disorder. And this is the first set of symptoms to emerge. The inattention symptoms will take 2 to 4 years to become fully visible and impairing. While there may be some manifestations of that in the early preschool years, they may not yet be impairing to the individual. 2-year-olds don't have to sustain their attention to very much. But by the time you're 5, you do. Or even 4 in preschool reading time, for instance. So we have then a problem with the brain's inhibition system that is not developing on schedule. And that is characterized by problems with disinhibition across all aspects of brain functioning: verbal, motor, as well as cognitive and emotional, which is left out of the DSM-4, but which many of us have been on a tear over the past couple of years to make sure that clinicians, and hopefully DSM-5, will at least include the fact that emotional impulsiveness is just as central a feature of ADHD as is verbal and motor impulsiveness. These are very emotional people. They don't have a mood disorder because their emotions are normal. The problem is their emotions are not self-regulated. The top-down executive control over the primary emotion is lacking or impaired. The emotion itself is rational, but it will be more extreme because the individual is not moderating it using the executive system. So ADHD causes a problem in the top-down self-regulation of primary emotions. And that leads people to be very demonstrative of their emotions. Emotions are up, out, done, over, with little moderation. And even when they're instructed to moderate, they have some difficulties doing so. So it's not a mood disorder, but it can look like one if you are not careful and include emotional impulsiveness as part of your understanding of the disorder. You would start to diagnose that as oppositional disorder, bipolar disorder, unipolar depression, or some other disorder that wasn't necessary if you had only understood that emotion was part of this disorder along with the cognitive and the verbal and the motor impulsiveness. So there's the emotional aspect to ADHD. Now, the cognitive aspect of ADHD is little appreciated in the DSM-5, or 4 rather, and that is because DSM-4 has only 3 items assessing inhibition, and they're all verbal, which was a huge mistake. So hopefully DSM-5 is going to try to correct that by putting in some other symptoms of impulsiveness other than just talking too much or interrupting other people. But for now, one of the limitations of DSM-4 is it loaded on the verbal aspect of impulsiveness and missed some of the others. For instance, ADHD individuals steeply discount the future. This is known as having a high time preference in economics. You know it as delay of gratification. The inability to work for a longer-term goal. The individual discounts the consequence by the magnitude of the delay. All humans do that. All animals do that as well. But they do it more steeply than people of their age should be doing. And as a result, the more the consequence is delayed, the less influence it has over current behavior and decision making. So that is a very important treatment issue. It means that when you design treatments, your consequences have to be very quick. If you're setting up a token system in a classroom where the individual can't cash in their chips until Friday for some silly little pizza party, game over. You lose. That will not work with an individual who is discounting the future as steeply as they do. So we can use this finding to our advantage in designing prosthetic environments around people with ADHD, making sure that we have arranged for relatively rapid, immediate, frequent consequences. And now you know where that comes from. It comes from the steep discounting or high time preference of the future. The future gets no traction with them.